For me personally, I've had my own workplace mental health crises, and really in that moment felt that there was no one else in the world experiencing these types of mental health challenges, which is so untrue. We know that 1 in 5 people in the United States live with a diagnosed mental illness. And so I am really passionate about workplace mental health because I want to increase the awareness that a lot of people do live with mental health challenges. I think oftentimes when you're having mental health challenges in the workplace, you don't even know that it's happening because we're just so focused on getting through the day-to-day and doing our work tasks and surviving that we might not even realize that there's an issue going on. So for me personally, I had no idea that there was an issue going on until it got to a crisis scenario. And people didn't reach out, and to no fault of their own, but a lot of times people don't know how to reach out. So by workplaces training other colleagues on how to recognize signs within a colleague that something could be going on is really effective, because someone might not always realize when they're in the thick of their issues that they're having a hard time until someone reaches out to support them. At NAMI-NYC, we really believe in the power of lived experiences, and so in our workplace mental health initiative, not only do we provide trainings and consulting and different projects, but we really work to elevate the lived experience of people working with a mental illness, because oftentimes their voice is not included. But the best way to understand how to create workplace mental health is to listen to the people who work and live with a mental illness, to hear what they need and how workplaces can best respond to those needs. We've had feedback from managers who said that they feel more equipped, that if an employee was to come with them with challenges, that they would feel more confident in knowing how to respond, what to say, and how to connect them with resources. We've had other people share that attending our trainings feels like a safe space where they're feeling that there are other people in their community going through similar challenges and they're not alone. And they find solace in knowing that there's hope for recovery for themselves or their loved ones. It's actually extremely effective for productivity, and there's a strong business case for why creating mentally healthy workplaces is effective. We know that workplace mental health challenges creates absenteeism, and where people are not showing up to work as often, and if they are, they're not as productive as they typically are. We also know that mental health challenges can lead to retention issues, so employees are more likely to leave a workplace, and this can be a very big cost for employers. We've seen over the years a lot of statistics showing that employees are increasingly caring that their employers take care of their mental health, that they provide adequate mental health resources, and that they want to work in a place that feels psychologically safe. And so employers are having to respond to this need and this demand. When employers are going out and looking for jobs, they are thinking about this. What's the culture of the place I'm working at? Do I feel that it's an open and safe environment where I can share my ideas and be my authentic self at work? And so employers are adding new resources for mental health. We've seen employers shifting some of the organizational policies that best promote mental health in the workplace. It's easy to just view our colleagues as a worker, but we are full human beings, and we can't just leave our outside lives at the doors when we show up to work.